You've been diagnosed with adenomyosis and now you're worried that it may affect your fertility. I get it. Stay tuned and I'll explain what it is and what you can do to boost your fertility with this condition. Hi, I'm Melanie, a fertility and prenatal dietitian. Adenomyosis is a condition where the cells which normally form a lining on the inside of your uterus also grow in its muscle wall. Adenomyosis is only seen in women in their reproductive years because its growth requires a hormone called estrogen. And after menopause, when our estrogen levels plummet, adenomyosis decreases. Unfortunately, women with this condition may find it more challenging to conceive. And when you do conceive, it's believed that women with adenomyosis may have an increased risk of having twins or multiples. Now, it's important to note though that it is definitely not a given that you'll have either. As it's not a super common condition, there's still a lot of confusion about the best way to diagnose it. And of course, it depends upon how severe your case of adenomyosis is. So please try not to worry until the problem arises. However, with that said, it's always a good idea to start trying to conceive sooner rather than later, and especially when you have a condition like this. Now, there's a couple of reasons why researchers associate adenomyosis with difficulty conceiving. Firstly, it can impact the ability of your uterine muscles to contract appropriately. Secondly, endometrial cells that may have jimmied their way inside the muscle may release chemicals that can make it harder to conceive. And thirdly, adenomyosis can make it more difficult for the embryo to implant. So even if you're going down the IVF route, it can be a little bit more tricky to conceive than usual. Now, although the majority of treatment options for boosting fertility with adenomyosis are medical, there is some emerging evidence for dietary treatments. Firstly, reducing oxidative stress by having a diet rich in antioxidants is essential. Initial studies suggest that women with adenomyosis may have abnormally high levels of these oxidative bad guys in their reproductive system. So include plenty of nutritious, antioxidant-rich, colourful fruits and vegetables every day. Secondly, inflammation is also a big issue for people with adenomyosis. So focus on reducing inflammation with good omega-3 fats and restricting your intake of foods which exacerbate inflammation, like sugar and alcohol. And thirdly, if you do have high estrogen levels, discuss isoflavone-containing foods with your dietitian. Isoflavones are naturally occurring chemicals found in some plant foods which mimic estrogen in your body. Excess levels of body fat can also cause excess estrogen production, so this may be a factor to consider as well. Now, I'd recommend downloading my free fertility meal plan to help get you started. Just go to melaniemcgrice.com/fertility. And check out some of my other videos, particularly ones on optimizing implantation and reducing the risk of miscarriage. And if you have any further questions, please feel free to reach out. I look forward to seeing you in my next video. Adenomyosis. And I'll leave it from there, because I've already done it.